40% of my patients with serious prostate problems masturbate daily. In 15 years of practice, I have heard one question more than any other. Does daily masturbation destroy my prostate? And every single time, I see the same fear in men's eyes. Here is what nobody tells you. Daily masturbation does not destroy your prostate. But here is what will make you uncomfortable. If masturbation is safe, why are 4 out of 10 men in my office with chronic pelvic pain, weak urine stream, and erectile problems doing it every single day? You see the contradiction? Something does not add up here. And this confusion is costing men their sexual health. So let me be crystal clear about what is really happening. The problem is not the masturbation itself. The problem is 3 specific things that 95% of men do completely wrong. And one of these things is so dangerous that it can turn a perfectly healthy habit into chronic prostatitis in just 6 months. Nobody warns you about this. Not health websites, not forums, not even most doctors. So men keep making the same mistakes day after day, slowly damaging their prostate without even knowing it, until one day they wake up with pain that does not go away. Today, I am going to tell you exactly what these 3 dangers are and how to avoid them. Stay with me because by the end of this video, you will understand why some men can masturbate daily for decades without problems while others end up in my office after just a few years. Before we talk about the 3 dangers, you need to understand what actually happens inside your body during masturbation. Because most men have no idea how their prostate works. Let me explain this simply. Your prostate is a small gland about the size of a walnut. It sits right below your bladder and surrounds part of your urethra. Every time you ejaculate, your prostate produces most of the fluid that comes out. That fluid contains nutrients, enzymes, and other substances that keep sperm healthy. Now here is the important part. Your prostate constantly produces this fluid, day and night. Whether you use it or not, if you do not ejaculate regularly, that fluid just sits there. It accumulates. It stagnates. And you know what happens to any fluid that sits in one place too long? It becomes a breeding ground for bacteria and inflammation. This is called prostatic congestion. And it is one of the leading causes of chronic prostatitis. So when men ask me, does frequent masturbation harm the prostate? I tell them, look, the opposite is actually true. Regular ejaculation helps flush out your prostate. It keeps things moving. It prevents stagnation. The research backs this up. Studies show that men who ejaculate 21 times per month or more have a lower risk of prostate cancer compared to men who ejaculate less frequently. 21 times a month. That is about 5 times a week, but here is where it gets interesting. Those studies do not specify how men ejaculate. Sex or masturbation. Gentle or aggressive. With or without pornography. They just measure frequency, and this is the problem. Because frequency is only one part of the equation. Let me tell you about the 2 biggest myths I hear every single day. Myth number 1. Masturbation depletes your prostate and makes it weak. This is complete nonsense. Your prostate does not get tired from producing fluid. That is literally its job. It is designed to do this. Myth number 2. Frequent masturbation causes prostatitis. Wrong again. Masturbation does not cause inflammation. In fact, ejaculation reduces prostatic congestion, which actually prevents some types of prostatitis. So if masturbation is protective, if it helps keep your prostate healthy, why am I seeing so many men with problems? Here is what blows my mind. 40% of my patients with chronic pelvic pain syndrome masturbate daily or almost daily. They are doing exactly what the research says is healthy. Regular ejaculation. Keeping things flowing, but they are still sitting in my office with pain, inflammation, and urinary symptoms that are ruining their lives. So what is going on? The answer is simple, but most men do not want to hear it. It is not what you are doing. It is how you are doing it. The technique matters. The mental state matters. The physical habits around masturbation matter, and this is what nobody teaches you. Not health websites. Not sex education. Definitely not pornography. So men develop habits based on what feels good in the moment. Not what is actually healthy for their prostate and pelvic floor, and over months and years. Those habits create real physical damage. Microtrauma to tissues. Chronic tension in pelvic muscles. hormonal and neurological changes that affect sexual function. Now I am going to show you exactly what those 3 dangers are. Pay close attention because once you understand these, you will never look at masturbation the same way again. Now let me tell you about 3 things that actually destroy your prostate health. And after 15 years of practice, I can tell you these are the real problems, not the masturbation itself. First one catches everyone by surprise. Aggressive technique. You think masturbation is masturbation, right? How can you do it wrong? Well, let me explain what happens. Your urethra is delicate. The tissues are soft. When you grip too hard, stroke too fast, use what we call a death grip, you create microtrauma. Small tears. Inflammation. You do not feel it immediately. That is the trap. It feels fine, maybe even better. But over weeks and months, that trauma accumulates. The tissues stay inflamed, and eventually you develop chronic pelvic pain. I had a patient last year, 32 years old, burning pain after every ejaculation. No infection, no structural problems, just chronic inflammation from aggressive technique. You know why he used such force? Because over time he needed more stimulation. His sensitivity decreased, so he compensated with more pressure. Classic mistake. Here is how you know if you are too rough. Any redness afterwards. Burning during urination after masturbation. Needing harder grip every month. That is the warning. The fix? Use lubrication. Always. Cut your grip pressure in half. Slow down. I know it feels less intense at first. That is the point. You are retraining your sensitivity. Second danger. And some of you will not like this. Pornography addiction. Look, I am not judging what you watch, but I am telling you what it does to your body. Pornography gives you unlimited variety. Extreme content, constant novelty. Your brain releases more dopamine than normal sex ever could. So you develop tolerance. You need more intense content. Longer sessions. Instead of 10 minutes, you are going for an hour. Sometimes more. You edge. You hunt for the perfect video. And all this time your prostate is in prolonged arousal. Your pelvic floor muscles stay contracted. Blood flow restricted. Do this daily and you create chronic pelvic floor dysfunction. Muscles stay tight. They do not relax. This causes pain, difficulty urinating, erectile problems. I see dozens of men in their 20s with these exact symptoms. The fix is brutal. 90 days. No pornography. Completely. You can still masturbate but without screens. 15 minutes maximum. No edging. Your brain will hate it at first. Too boring. Not enough stimulation. Ignore it. After 3 months, your natural sensitivity returns. Third danger. This one makes me angry. Ignoring symptoms. Your body sends signals. Most men ignore them until the problem becomes chronic. Here are the red flags. Pain after ejaculation. Any pain. Blood in semen. Get checked immediately. Weak urine stream under age 50. Sudden erectile dysfunction. Waking up 3 or 4 times at night to urinate. You know what most men do? They Google it. Read forums. Try supplements. Everything except see a doctor. So acute inflammation becomes chronic. I had a patient who waited 2 years. 2 years of pain before coming to me. By then, we needed 6 months of physical therapy to fix him. If he came after 2 weeks, 1 month treatment. Done. My rule is simple. Any of these symptoms for more than 1 week, see a urologist. Not next month. 1 week. Your body is telling you to stop. But instead, men push through the pain thinking it will desensitize. Wrong. You are making it worse every single time. Now you know the 3 real dangers. Aggressive technique causing tissue damage. Pornography creating pelvic floor dysfunction. Ignoring warnings until problems become permanent. But here's what you need to know next. How do you tell if you already crossed the line from healthy to unhealthy? So you watched all this and now you are thinking, okay doc, but how do I know if I already have a problem? Good question. Let me give you 4 clear signs that you crossed the line. Sign 1, compulsive behavior. You cannot stop even when you want to. Listen, healthy sexual desire is natural. You feel aroused, you masturbate, you move on with your day. But when it becomes compulsive, that is different. You are not horny. You are bored, stressed, anxious. And you automatically reach for masturbation like other people reach for cigarettes. Multiple times a day, not because you want to, because you feel like you have to. That is not sexuality. That is compulsion. Second sign, it interferes with your actual life. You are late for work because you had to masturbate first. You cancel plans. You avoid intimacy with your partner because you already finished 3 times today watching screens. You neglect responsibilities. If masturbation is taking priority over real life, you have a problem. Third sign, you need increasingly extreme content. What aroused you a year ago does nothing now. You keep searching for harder, weirder, more shocking material. Your tastes escalate. This is your dopamine system breaking. And when you finally try to have real sex with a real person, nothing happens. Because your brain is wired to screens, not humans. Fourth sign, physical symptoms. Pain after ejaculation. Burning during urination. Weak stream. Difficulty getting or maintaining erection. Premature ejaculation. Delayed ejaculation. Any of these. Your body is screaming at you. Listen to it. Here is my golden rule. If anything hurts after you masturbate, that is not normal. Period. Pain is not supposed to be part of this. Discomfort is not normal. Your body is telling you to stop. You know what most men do when they recognize these signs? Nothing. They think it will get better on its own. Or they convince themselves it is not that bad. Classic denial. So let me ask you directly. Do you see yourself in any of these 4 signs? Be honest. Because if you do, you need a plan. A real protocol to fix this before it gets worse. And that is exactly what I am giving you next. Alright, so you recognize the problem. Now what? Let me give you a real protocol. Not theory, not suggestions. A clear plan that works. First, optimal frequency. The research shows 21 ejaculations per month is protective for prostate health. That is about every other day. Some guys do it daily. Fine. Some do it 3 times a week. Also fine. The key is consistency, not obsession. If you are doing it multiple times a day, every single day, that is probably too much. Not because of frequency. Because you are probably using aggressive technique or spending hours on screens. Scale back to once a day maximum. Give your tissues time to recover. Second, proper technique. Use lubrication. Always. Water-based is fine. Silicone-based lasts longer. I do not care which one. Just use it. Dry masturbation with a death grip is a one-way ticket to my office. Reduce your grip pressure by half. I know it feels less intense. Good. That is the point. Slow your strokes. No jackhammer speed. Your urethra is not a construction site. And if you feel any pain or burning, stop immediately. You are doing damage. Third, if you recognized yourself in the pornography section, you need a reset. 90 days. No screens during masturbation. 0. You can still masturbate. Actually, you should. But use only physical sensation or imagination. Keep sessions under 15 minutes. No edging. No hunting for content. This is going to suck for the first 2 weeks. Your brain will tell you it is boring. It is not enough. Ignore it. By day 30, you will notice changes. By day 90, your natural sensitivity returns. Erections get stronger. Orgasms feel better. Real intimacy becomes appealing again. Fourth, learn proper pelvic floor exercises. Not the Kegel exercises women do. The male version. Here is how. When you urinate, stop the stream mid-flow. Feel those muscles? Those are your pelvic floor. Now do not actually do Kegels while urinating. That is just to identify the muscles. Instead, contract those muscles for 5 seconds. Relax for 5 seconds. Do 10 reps, 3 times a day. This strengthens your pelvic floor and improves ejaculatory control. But listen carefully. If you already have pelvic floor dysfunction, if your muscles are too tight, Kegels make it worse. You need the opposite. Reverse Kegels. Gentle stretching. Physical therapy. This is where you actually need professional help. Alright, you have the protocol. Use lubrication. Gentle technique. 90-day reset if needed. Pelvic floor work. But here is what nobody tells you. There are specific symptoms that mean stop doing protocols and get to a doctor immediately. Let me tell you exactly what those red flags are. Now let me tell you when to stop Googling and get to a urologist. Not next month. Not when it gets really bad. These 5 symptoms mean go now. First, any pain that lasts more than 1 week. Pain after ejaculation. Pain in your pelvis. Lower abdomen. Perineum. The area between your testicles and anus. If it hurts for 1 week straight, that is not going away on its own. That is inflammation. That needs treatment. Second, blood in your semen or urine. I do not care if it is just a little bit. I do not care if it only happened once. Blood means something is wrong. Usually it is benign. Broken blood vessel. Minor infection. But sometimes it is not. You need to get checked. Do not wait to see if it happens again. Third, significant changes in urination. Weak stream that keeps getting weaker. Difficulty starting. Having to push. Dribbling after you finish. Waking up 4 or 5 times at night. If you are under 50 and experiencing this, your prostate is either inflamed or your pelvic floor is dysfunctional. This needs evaluation. Fourth, sudden erectile dysfunction. You had normal erections 6 months ago. Now you cannot get hard or cannot stay hard. And the only thing that changed is your masturbation habits. This is not in your head. This is real physical dysfunction, probably from pelvic floor problems or vascular changes. Needs treatment. Fifth, you cannot stop despite negative consequences. Missing work. Avoiding relationships. Choosing screens over real intimacy. Physical pain, but you keep going anyway. That is addiction. And yes, you need professional help. Not just a urologist. Probably a therapist too. You know why men avoid the doctor? Fear of the exam. Let me tell you exactly what happens. You talk. I ask questions. When did symptoms start? How often do they occur? Any blood, pain, discharge? Then physical exam. Yes, I check your prostate. Digital rectal exam. Is it comfortable? No. Does it hurt? Not really. Is it necessary? Absolutely. Takes 30 seconds. Then maybe some tests. Urine sample. Sometimes blood work. Sometimes ultrasound. That is it. No torture. No judgment. Just medical evaluation. Here is my professional opinion after 15 years. Most men wait way too long. They suffer for months or years before coming in. And by then, acute problems became chronic. Treatment takes longer. Recovery is harder. Do not be that guy. If you have any of these 5 red flags, make an appointment this week. Let me wrap this up. Daily masturbation does not destroy your prostate. The research is clear on that. Regular ejaculation is actually protective. But technique matters. Mental state matters. Paying attention to your body matters. The 3 real dangers? Aggressive technique causing tissue trauma. Pornography-induced hyperarousal creating pelvic dysfunction. Ignoring warning signs until problems become permanent. All completely preventable if you know what to watch for. Here is my golden rule. If anything hurts, if anything feels wrong, that is your body talking. Listen to it. Take a break. Adjust your approach. And if symptoms last more than a week, see a doctor. Not next month. This week. Because acute inflammation responds to treatment in weeks. Chronic inflammation takes months or years. You want to maintain healthy sexual function into your 50s, 60s, 70s? Start taking care of yourself now. Use proper technique. Give yourself recovery time. Stay aware of your body's signals. And do not let shame or embarrassment keep you from getting help when you need it. If this video helped you, hit subscribe. Leave a comment telling me what you want me to cover next. And remember, everything I tell you here is general information. For your specific situation, you need to consult with your physician. Get evaluated. Get proper treatment. Take care of your health. See you in the next video.